Well, what we found with the work of our Center for Transforming Healthcare is that complicated problems can't be solved using the simple best practice. That is, the 4 or 5 things that one place did to solve a problem may not be applicable to another place. What we've seen when we've applied our tools of robust process improvement, or Lean, Six Sigma, and change management, is that complicated problems like hand hygiene, like the risk of wrong site surgery, like handoff communication, have many causes of failure. Not just 3 or 4, but most often 10, 15, 20, 25. Each of those specific causes of failure has an effective intervention that needs to be targeted only to it. If you don't have hand gel dispensers in the right place, then it doesn't matter how much hand gel you buy. You're not going to get a good result. So many causes for the same problem. Each cause requires a different intervention. And then what we found repeatedly in all of our center work is that the 4 or 5 causes of failure that explain the majority of the reason that hand hygiene doesn't work or handoff communication fails, the 4 or 5 that explain the majority of failures in one place are very different when you go to the next place, the next hospital. And so the same things that work in the first hospital, you wouldn't expect to work in the second hospital if the causes are very different. We've been looking at the lessons that we think healthcare can learn from organizations like nuclear power, commercial aviation, amusement park safety, those organizations that have achieved and sustained incredibly high levels of safety over long periods of time. And basically what they have in common with each other, in addition to a really fanatical devotion to safety, is that they employ very effective process improvement tools. And they have a very effective safety culture that wraps around very highly performing processes and keeps them working for long periods of time at that very high level of safety. The way high reliability organizations stay safe is that everyone inside that organization, whatever their job is looking at the small things that are wrong today, the tiny things, the machine that doesn't quite sound exactly right, the safety protocol that somebody had to develop a shortcut around because it didn't quite fit the circumstances they were working in. The small things that are signs that a process is going to break down in ways that they've never seen before. They identify those things when they're very small, and when they're easy to fix, they report them up their chain of command. They get fixed right away before they pose any serious risk to the organization. And that gets communicated back to the folks that identified the problem in the first place. Now, when you think about healthcare, we are most often in the situation of having had a patient be harmed and looking backward from that event to try to figure out why it happened and what we can do to prevent the next one. That is not how high reliability organizations stay safe. They have to trust that report will be acted on, and management will use very effective tools to solve the problem, and that information gets communicated back to the folks who originally reported it. It's a very positively reinforcing set of forces that lead to the establishment and maintenance of a safety culture. We've had a requirement in our accreditation programs now for 3 or 4 years that it is leadership's responsibility to establish a culture of safety. And so the principle is already there. What we mean by leadership is also embodied in the accreditation program. It's all of the components. It's the governing body, the physician leaders, the management, the nursing leaders. All the components of leadership have to be engaged around this process. And indeed, in getting to high reliability, the first change is leadership commitment to 0 major quality failures. So what we're now starting to do with center projects and with other tools is answer the question of how. The what is in a large number of those whats are in the accreditation manuals, establish a culture of safety. But the questions we get back legitimately are how? What do I do today? What do I do tomorrow to start down this road? And that's what we're providing with the center's tools and with other tools to try to get the answers to those how questions. The three critical changes that healthcare organizations have to undertake to get to high reliability are the leadership commitment to zero major quality failures, the full embodiment and implementation of safety culture, and the full deployment of these tools of robust process improvement. And we're working on very specific programs and strategies to give to organizations that want to undertake this journey so they can make progress across all those different domains. We're all familiar with the wide variety of different changes, different demonstrations, experimentation that are going on throughout the delivery system with new models of payment, with new models of care delivery. And the Joint Commission, I think, is right at the forefront of all of those changes. We recognize, though, because we now accredit or certify nearly 20,000 healthcare organizations in the United States, that our customers are at very different places along these very different change continuums, if that's a word. And so we have to be responsive to where our customers are and what they need in order to make progress toward their goals in this very uncertain and change-ridden environment.